Hi, everybody. It's Jessica DeMassa with WTF Health. What's the future health? We are talking to the who's who of health tech. And so I have a very hot, very young startup. Meet their CEO. This is Naomi Allen. She is the co-founder and CEO of Brightline. And you guys are doing a lot of really disruptive stuff in a space that we don't often hear about innovation. Pediatric medicine, not just any kind of pediatric medicine, pediatric mental health care. So Naomi, thank you so much for joining us. It's great to
Thank you
have
for
you with us.
having me. Appreciate it.
All right, you guys have caught my attention for a number of reasons, not only the fact of your area of focus, but also you have raised a staggering amount of money for how young you are. So you founded at the end of 2019, already $25 million in funding. Your seed was led by Oak. Oak returned and Threshold was with them. So tell me a little bit about what you guys do. What is Brightline?
Yeah, thanks so much. We're the first and only platform that's really scaling a broad care delivery system for pediatric behavioral health. So we're heavily using technology and clinicians and coaching to support pediatric behavioral health across conditions. So if you think about kids, they have anything from anxiety, depression, ADHD to things like speech delays or social communication challenges if they're on the autism spectrum. And quite a number of kids also need medication support when that's appropriate given their age. And so we have a full stack clinical model that is scaled by technology that's delivering medicine for kids with a scaffolding of support services for the parents of kids with behavioral health needs. So really exciting, very innovative model. We don't know of anyone else out there that's doing this, so it's not surprising you haven't heard much about pediatric behavioral health because we think we're the only platform really delivering this type of medicine for families.
So give me a sense of the age range of children that you're dealing with here, because PEDS is big. I mean, it goes all the way from really like what, birth, infancy, all the way up to like 18, right? So, I mean, is there an area of childhood here that you're focused on in particular, or how does that work?
Yeah, the sweet spot really for us for starting has been young kids to adolescents. And the reason for that is about
What's young?
75, pardon me?
What's young? Like, give
Oh,
me
yeah. So we'll start with, kids as early as 3 up through about age 12 right now.
Okay.
And it's because about 75% of all severe mental illness manifests before the age of 14. So it's really important for families to have accessible, affordable, really high quality care when kids are young. And most families don't get that treatment. If you look at kind of broad speaking, 1 in 5 kids have a behavioral health diagnosis. Most clinicians think another 1 in 5 kids actually probably have a behavioral health condition, but because there are so few clinicians out there, they're never getting a diagnosis. Of all the kids that are diagnosed, only 20% ever get any care.
Wow.
So the state of the art is it's very frequent to have a child that has behavioral health needs, but the state of the art is pretty dire. So what we're doing is innovating this really common set of family challenges with an uncommon support system.
Okay. Walk me through exactly what you guys are providing. And I know that you are just recently launched. So, I mean, what is this experience like? I mean, and I guess let's focus on from like the parent and the child perspective right now. And then I do want to ultimately talk about the provider experience and the response you've been receiving from payers. But I do want to start with, that patient experience, the patient and their caregiver. What is this like? What are they experiencing? Is it one-on-one coaching? Is it apps? Is it like, tell me a little bit more about it.
Absolutely. Well, let me first start by saying I'm a mom of 3 kids, and my own journey to found the company has been as a parent. A couple of years ago, my oldest son developed a number of things and needed both behavioral treatment for anxiety as well as treatment for some sensory challenges and also some fine motor skill support. So we just, as parents, were navigating this very chaotic system. We didn't know where to start. We called a bunch of clinicians. We were on wait lists for 6 months. It was all cash pay. None of our clinicians talked to each other. Nobody told us as parents how we could actually be involved in our son's treatment to help him reach like clinical goals faster. So that's the state of the art right now for parents. It's a very, pediatric behavioral health is a very fragmented kind of, mom and pop paper-based industry still. So when we started the company, the first thing we did was go out and talk to a bunch of families. We mapped out their pain points. We really worked backwards to define care journeys that work for families. So how it works today is a family will hear about us either through their employer or through a pediatrician or through their school, and they come to us and they can either talk directly to a coach to find out what type of clinical care is most appropriate for them, or we've developed online clinical screeners that are based on the NIH's screeners for kids, kind of like the pediatric equivalent of like the GAD-7 or the PHQ-9, if
Okay.
folks know those. And so families can just come and with no obligation assess, like, does my child need help? And if they need help, then we bring them into Brightline. What's really unique about our model is we have full stack clinical support. So we have psychologists, psychiatrists, occupational therapists, speech language pathologists. So what we can do is a multidisciplinary intake, which sounds really wonky, but the reason that matters is because most kids have more than one thing going on and parents don't know where to start.
Yeah.
So when we start to support a family, we can say, okay, what's the right place for this child to start? Okay, they need to start with their anxiety before we're dealing with their social communication challenges, or they need to start with behavioral treatment. And then if they don't respond to that, then we'll put them on a medication protocol. So we've got the ability to support full stack care. The care delivery right now, we've built all of our protocols for telehealth delivery. So really excited about that. To be able to deliver telehealth protocols for kids takes a lot of family systems design work. How do you create a therapeutic bond with a child even as young as the age of 5? What role do parents need to play in that? And then we're using technology to scale a bunch of innovations that have existed in pockets but haven't been scaled nationally.
Okay.
So examples of that are interventions that parents can practice with their kids at home, and that's all scaled using a coach. So a coach partners with each family to make sure that the parents know, what is the child working on, how can I support that? And we use technology to scale that parent-facing platform.
And I'm sure, like, I mean, I know you're early on in your launch, but I mean, I'm sure you're probably getting some feedback from those who are participating in this early. What are you hearing from kids?
Yeah, I think that, not surprisingly, the main thing is that kids really do respond very effectively to treatment pretty quickly.
Okay.
So I think a lot of times parents will wait so long to get their kids in treatment, but we know that treatment for anxiety is really effective. We know that developing family skills and processes around kids that have challenges with ADHD or attention is really critical, especially right now when so many kids are going through, distance learning and homeschooling. So what we're hearing predominantly is just this overwhelming sense of relief from families that we can give them very practical tips that start to really shape behaviors and patterns pretty quickly. And that, that the kind of the magic of what we're doing is care delivery for kids wrapped around this family systems approach where we teach parents or caregivers how to actually support that care delivery just so we get outcomes faster.
I want to talk about that side of it too. So on the parent side, and then even bigger, like, I mean, you had said a lot of people will find out about Brightline from their employer, or from the school system. And so talk to me, I guess it's like that whole, it takes the village kind of approach. And I think especially now in a time where, people, depending on where you're at in the country, people are still, sheltered in place. I mean, it's been a long, hard road with COVID, especially for kids who, now it's like, what is their back to school experience? Some of them might be in the classroom, but there's anxiety with that. Some of them might be at home, and that presents a different set of challenges. So, I mean, as far as, that caregiving population around the child, beyond just their parents, but their parents, and then the employers who support the parents who, understand the dynamic of what a Zoom call is when your kid is not, not at his best or at her best. Tell me a little bit about how the response there and what you've been hearing feedback wise from parents, and then also from their employers or from the other support systems that they have access to.
Yeah, absolutely. I mean, I think this won't surprise any parents who are listening, but there was a recent study in the New York Times that surveyed over 1,000 parents and said, what's the number one thing right now on your mind as it relates to your kids? And so I think like 78, 79% of parents said, COVID exposure. And then 77% said our child's social relationships with other kids. And then like 76% said their mental health. And by the way, what was so interesting is it was both for moms and for dads. And so this is kind of universally, 2 of 3 of those things are things that we support, right? The ability to develop, stronger social interaction, social communication, child to child interactions, supporting those using technology and using scalable clinically based protocols, and then obviously supporting pediatric mental health, which is the bread and butter of what we do. So, I think the biggest thing that we've heard as we've been, out in the market talking to employers and health plans has just been how fast can you scale to my employees? Because, one of the things that I think is kind of the, perhaps the unspoken challenge for adult behavioral health is that if you're the parent of a child that has behavioral health stuff going on, how much that affects you as a parent. When we started the company, we worked with a guy who is a PhD health economist at Rand, and we ran essentially comorbidity analytics to see if you're the parent of a child with behavioral health condition, how much likelier are you to have your own behavioral health stuff going on? And we found that parents that have a kid with a diagnosed behavioral health condition are 50% likelier to struggle with depression.
Wow.
And I think any parent who is going through this journey, you're seeing your child struggle, you're seeing your child lose sleep at night, maybe you're losing sleep at night because your child is anxious. It's just obvious that there is comorbidity within families. And so I think employers are waking up to the reality that if you are offering a behavioral health solution for your employee population and it's adult focused, you're not offering the right answer. You also have to have a pediatric behavioral health offering for your employees to be able to focus at work, to be able to, prevent some of their own stuff going on from an anxiety and depression perspective. And, unfortunately, the adult behavioral health companies can't scale. The protocols are different. The clinician training is different. The way that you interact with a child and set up appropriate safety standards is different. The testing and the mechanisms to evaluate progress are different. So, it's really taken a company like a Brightline that starts with a child focus to be able to develop a solution like this.
Say more about the provider side of this, because I mean, this is, I think, I want to kind of highlight the delineation there, and I want to hear what you've been hearing from some of the child-focused psychologists or psychiatrists that you've been working with. I mean, how have they responded to Brightline?
I think, well, here's what I'll say. First of all, I think it's incredibly exciting because many of our clinicians have spent their careers doing really innovative work, but have not been able to scale that nationally. And so I'll just give you a couple of examples. Our chief medical officer, David Grodberg, is a renowned child and adolescent psychiatrist. He was the executive medical director for the Yale Child Study Center. So Yale is an incredible place for pediatric behavioral health medicine. And there he invented and worked with a set of colleagues to build the only clinically tested parent-facing set of protocols to coach parents of young kids that have a behavioral health condition. And so they ran RCTs on these. The protocols totally work, but we've gone and licensed that, and now we're scaling it. So the ability to take this innovation that's existed in a small pocket of medicine and use technology to roll it out, I think is just incredibly exciting for a lot of our clinicians. The other piece that I think our clinicians are really excited about is practicing multidisciplinary care.
Okay.
So if you're a child therapist or OT or speech language pathologist, and you're seeing a child and they would benefit from seeing a psychiatrist or getting behavioral treatment, it is really frustrating as a clinician because if you say that to the family, they're going to go sit on an 8-month waiting list, or they're going to have a really hard time trying to get that treatment that they need that's going to make the child better. Well, in our world, we do multidisciplinary care. We can do obviously an internal referral, and all the clinicians are working off the same clinical record. So what that means is it allows our clinicians to practice their best medicine. If they are seeing a child for behavioral treatment and they're also, they're being seen by a psychiatrist or medication or an OT for occupational therapy, then we round on the patients together. It's tech-enabled multidisciplinary care. And I think that just allows clinicians to practice their best medicine, which is really exciting for them.
Zoom out for me and let's talk a little bit about the market. So for those who may not be familiar with this space, I mean, I cover the digital mental health space quite a bit for the adult population, but I mean, like, talk to me specifically, I think, about what you see, how you see this fitting into some of the changes that have been overtaking this market recently. I mean, I feel like the push towards virtual care for mental health conditions, I mean, it's just changed so dynamically as a result of COVID. And I feel like, as we move forward, it's going to be impossible to scale this back. I mean, and now I think just talking to you and hearing about kind of, looking at children the same way and that their mental health the same way. Tell me what you see as the potential for this moving forward from a market perspective.
Yeah, I mean, we really believe we'll wake up a couple of years from now and have a nationwide platform that uses a combination of tools and levels of clinical care, right? So if you've got essentially a family that has a child that's actually not experiencing acute behavioral health needs, but the parents need some support, then we can deliver that using digital interventions and probably some coach-led care, which is very different than if you have a child who has complex care needs and they really need clinicians to help support that care, or even medication support, which is a very different thing. So we think the world, not surprisingly, is going to look both blended and stepped as we go. So the ability to have blended care over teletherapy, digital self-serve, maybe some in-person treatments. We'll see how that evolves in the COVID world. And then stepping into the right levels of clinical care as needed. So this notion of blended and stepped care, which I think has really started to exist on the adult space, but it's never existed on the child space. And then I think the other thing is, frankly, so much of care today in the pediatric space is not built on a backbone of evidence-based protocols. And I think that's why if you go talk to health plans, and I did this when we started the company, and I just said, yeah, it's super interesting. I went to health plans and they're all like, look, we have network inadequacy on the pediatric side. We'd love to bring you a network. Will you please come and network? And I said, well, sure, but your rates are atrocious. We can't afford to pay a clinician a living wage, in an $80 reimbursement structure. I said, why don't you increase your rates and you guys wouldn't have inadequacy of your networks? And what they said, which I thought was really interesting and made a lot of sense, was we would increase our rates, but we don't know who practices high quality medicine. We don't know who's following evidence-based protocols. We don't know who's giving great access, who's having high member satisfaction. And we said, well, that's all stuff that we do. We are a measurement-based approach. We use evidence. We train our clinicians to follow the protocols. We have a supervision structure. We measure clinical and global improvement scores. So we're an evidence-based.
Do you buy that? Is that really a good reason? I mean, you know this space better than I do. I'm asking honestly, like, is it really that unmeasured that you guys are so standout? Or is it one of those things where it's like, yeah, okay.
Yeah, so without naming names.
No, I'm not trying to throw anybody.
No, but a very,
sure, this is one of those spaces that I really don't know very much about.
Yeah.
Yeah.
So a very well-regarded,
say that.
Yeah, a very well-regarded chief psychiatric officer at a very progressive blues plan. We were talking, and he's phenomenal. And he was saying in their state, they went to all of their child psychiatrists and they said, we will pay you so much more if you show us that you're doing any type of measurement. You don't actually have to reach certain clinical outcomes. We just need you to measure. And the clinicians were like, that's not what we do. That's really going to be hard for us. And he was like, I don't understand how we're in this world. And, it's funny, I started in healthcare in 1996, which is the year that the Mental Health Parity Act and HIPAA both went into effect, right? And if you just look at kind of what's happened in HIPAA, where there's actually systems and compliance and processes around this versus the Mental Health Parity Act. And so, I think we're just in this world where I think health plans got hip to the need to actually support the next generation of adult behavioral health. And they're now getting hip to the idea that there might be an opportunity to do that on the peds side. And so that's where we are. But the state of the art has been pretty undocumented, not a lot of tracking of clinical outcomes, quality processes, fidelity. So when we went to health plans and we said, look, here's how we practice medicine, here's how we operate. It's all the systems of measurement on top of evidence-based protocols. I think it just made the conversation much more obvious.
Awesome. All right. So last thing for you, give us a sense of, because I'm sure people who are watching this are thinking to themselves like, yes, I need this. I want this. How can I get it? So tell me, you guys, like I said, I know you're early in your launch. So are you nationwide yet or not yet?
We're not nationwide yet. We're working through our expansion strategies. So we're doing a few things. We're actively seeing patients right now in California. So all of California. we're working through in-network coverage for 1/1. So we've got some announcements coming up there in a few weeks, which we're excited to share. And then for families that are outside of California, we're doing a few things. One is we have very specific, very practical webinar series that we're running for free. So it's things like, how do I help my child's anxiety when we're living in this world of, COVID and homeschooling and forest fires? We've been running these webinars a couple of days a week, and I think we saw yesterday 600 or 700 signups for the webinar yesterday. So those are available for free across the country. The other thing we're doing, which I think is super important, is we've built the only clinical screener for families that have kids to assess whether your child is going to have an increased risk of behavioral health needs due to COVID. And so it's called the COBE. We're rolling it out with a bunch of distribution partners who've been super excited about this. It's free. And it's about 15 questions, and families can take that and then see like, oh gosh, my child is actually at risk, or my child's not at that much risk.
I love that. What peace of mind, just
oh my gosh,
to have something to measure with. I love that.
You know what it is, Jessica? As a mom, it's, we used to have these ways to chat with other parents that just sort of check in informally. And so it was, preschool drop off, or your kids, soccer practice. And you would just be like, hey, my kid's struggling with the middle school transition. How's your kid doing? And you would have this way to kind of what I call like the parent water cooler.
Yeah.
You have this parent water cooler, and like that thing doesn't exist anymore, right? So all of a sudden, all of these parents are trying to navigate, like, is my child doing okay? How do I think about the impact of COVID? They're seeing these really frightening statistics, 1 in 3 kids that are dealing with anxiety. And so we wanted to create a clinical screener that has an evidence and a validation, and give it to them as a free, public health initiative. So we're rolling that out in October. We're really excited about that. That'll be available nationwide as well.
Awesome. Naomi, thank you so much for stopping by. I love hearing about this. Congratulations already on your early success. And I'm sure that, like many of us who are watching, we can't wait for you to achieve that national rollout strategy. But the stuff that you put in place already, I think those webinars and then this evaluation tool, I think are going to be really helpful in the short term. Thank you so much for stopping by. The company, Brightline, this is their CEO and co-founder, Naomi Allen. You can check them out, find them on the web. And if you want to check out more interviews with thought leaders and the folks that are really shaping the future of healthcare, please check out my YouTube channel. It is youtube.com/WTF Health. I'm Jessica DeMassa. Thanks for joining us.